Walsh. I'm a program manager at the National Association of Counties, and I'm going to moderate this webinar today. This webinar is part of Stepping Up, which is a national initiative to reduce the number of people with mental illnesses in jails. Stepping Up is a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation, with generous support from the U.S. Department of Justice, Bureau of Justice Assistance, and other private sponsors. So before we begin, I'll just go over some technical details just for folks who aren't familiar with the software. The webinar is being recorded. It'll be posted on the Stepping Up website for future viewing. You'll receive an email in the next few days with a link to the recording, as well as links to register for the next couple of webinars as well. And then immediately after the webinar today, you should receive sort of a pop-up to have you do a webinar survey. And so we'd really appreciate you doing that evaluation so we can make sure that the programming we're putting together is useful to you and really helps us going forward. So for logistics, to the right of your screen, you'll notice there's a control panel, and in the control panel there is a questions box. So at any time, feel free to use this box to type in questions or send us a message if you're having any sort of technical difficulties. We will respond to you privately if you have any questions. If you have questions about the content of the webinar, we will answer those questions at the very end of the webinar after our presenters have had a chance to speak. If you want to be able to view the presentation bigger, you can click on the small red arrow in the top left corner. And then as we get started, I wanted to conduct just a couple of poll questions. So if we could launch the first poll, please. Great. That looks about like it's just about everybody. Why don't we close that poll and then show the results? So interesting. So we've got some county elected officials. We've got about a quarter of you are from Health and Human Services. 15% are from law enforcement or corrections, just a couple of state folks, and then other. And so, you know, if you have some time, you know, we'd be interested in knowing what other means to you. If you want to put some responses in the questions box, we'd like to hear that. So why don't we close that poll, and then we'll launch poll number 2. Okay, why don't we close that one and let's see where folks are coming from. Great. So really a good mix, almost equal representation across the country. So that's really interesting. Great. Thanks everyone for joining us. Why don't we do one last poll right now? Great. Why don't we close that and show the results? Great. So looks like, I mean, lots of county folks, obviously, as we expected, and almost equal rural, mid-size, and large urban counties as well. So that's great and really sort of represents the folks who are involved in Stepping Up. So thank you, everyone, for participating in the polling. So since this is the first webinar of the 2017 series, and it's been a little while since we've done a Stepping Up webinar, I want to give you some quick background and information on the initiative. So Stepping Up, like I said, is a national initiative to reduce the number of people with mental illnesses in jails. And the purpose is really to bring together local and state leaders, people from criminal justice, mental health, substance use, really to support systemic long-term efforts to foster solutions to reduce the number of people with mental illness in jails. We know that more than 2 million adults with serious mental illnesses, schizophrenia, bipolar disorder, are admitted to jails across the country every year, and many of these folks also have a co-occurring substance use disorder. Many of the people who are with mental illnesses who are arrested are for relatively minor crimes, loitering, public disturbances, which really tend to stem more from their illness or addiction rather than their intent to do harm. And once these folks are incarcerated, they tend to stay longer in jails and are at higher risk of reincarceration than individuals without these illnesses. And so for these reasons, Stepping Up was really started as a means to elevate this issue at the national level. And I'd actually like to introduce Ruby Kazelbosh, who is the Associate Deputy Director for Justice System Policy at the Bureau of Justice Assistance at the U.S. Department of Justice, just to talk a little bit about BJA's interest in Stepping Up. So Ruby?
Nastasia, thank you so much, and welcome everybody to the webinar. BJA is so proud to support the Stepping Up initiative. Justice is administered locally, service provision for behavioral health happens locally, and if we're going to affect change, it's going to be within the counties, and that's why we think it's so important to support the Stepping Up initiative. One opportunity that I wanted to make sure that everyone on the phone knew about is that BJA's Justice and Mental Health Collaboration Program solicitation is open and out on the street right now, and it closes on April 4th. So the timing is really good as you're thinking about where you are in your initiative and what are the next steps that you might need to take. I would strongly recommend that folks take a look at that funding opportunity. It has 3 categories, and one of them really focuses on a comprehensive county analysis and strategic planning. The second category has a very new and a very strong focus on law enforcement, and really encourages law enforcement and their mental health partners to take a look at what strategies and policies they have in place, and helps them come to the conclusion and make a decision about a particular police and mental health collaboration. BJA stood up a police mental health collaboration toolkit that's available online that can help point you in the right direction and give you a lot of resources and information about not just crisis intervention teams and co-responder models, but the many different models that are up and operational and working for jurisdictions around the country. The third category of that funding opportunity is a catch-all and really focuses on implementation and expansion of efforts to both divert, meet the needs of, assist with recidivism reduction for people with mental illness that are coming into contact with the justice system. So I wanted to make sure all of you were aware of that and are so appreciative of all of your efforts and the fact that you've stepped up, and we wanted to let you know that we have resources to support. Thank you.
Great. Thank you so much, Ruby. We appreciate it. And, just want to reiterate, from Stepping Up's perspective, what a great opportunity it is for counties to have access to these grants, and really want to encourage folks. And you can get some more information about the grants that are available up on Stepping Up's website, as well as obviously BJA's website as well. So really encourage folks to look into those. So to sort of continue the introduction on Stepping Up, Stepping Up was launched really with the intent of having counties sign on to a call to action by passing a resolution or a proclamation to support the initiative, to commit to developing a plan within your own jurisdiction that really makes more effective use of your budget, improves public safety, better connects people to services in your community, and really encourages best practices and evidence-based practices for doing so. So on the Stepping Up website, you can access a template resolution that can be modified to fit your county's unique needs and your situation. In the resolution, we're asking counties to pledge to reduce the number of people with mental illnesses in jails, commit to sharing with your peers, sort of like we're doing on these webinars, and encouraging all of your county officials, employees, residents to participate in the initiative and really elevate this issue. As of today, we have 323 counties from across the country that have already signed on to the initiative by passing a resolution, so that's more than 10% of the nation's counties. These counties represent about 125 million people in terms of residents around the country, over 42 states, and we are getting more resolutions in every day, and we'd really love to have everybody on the phone and everybody across the country to join the initiative. Once you pass the resolution, just email it over to the initiative, and we'll make sure that we add your county up to this map. If you want to see a list, I know sometimes it's hard to look at a map, especially with 3,069 counties on them. If you want to see a list of the counties that are participating, you can find that on the Stepping Up website, stepuptogether.org. So real quick, I want to do a poll question about this and see how many of the folks on the phone are in a county that has passed a resolution. So can we launch that last poll? Great. That looks like just about everybody. Why don't we show the results? Wonderful. So more than a half of folks on the phone know your county has passed a resolution, so thank you so much for participating. And we've got some other folks who are working on it and some folks who are unsure. So I would be sure to go and check out the stepuptogether.org website and see if your county is already participating in the initiative, and if not, look at the template and see if that's something that you can encourage within your county to do. So for those of you who are interested in starting your initiatives or enhancing your initiatives to reduce mental illness in jails, and then, we've got a lot of folks who have been doing this for a really long time, the Stepping Up partners have developed a series of technical assistance resources that we have available to help you create and implement some of these strategies that you're hearing about on this webinar and that you're seeing across the country. And we're continuously updating this resources toolkit. So the toolkit, when you go to the website, it's stepuptogether.org/toolkits, as you can see on the screen. The resources are broken up into 5 different modules. So when you click on those modules, you'll see archived and new webinars, some self-assessment tools, and examples and research of counties that have been doing some of this work. So we definitely encourage you to go check out the website. The intention is that you'll use these tools on the ground to encourage and support the conversations that you all are having about the initiative. We know that some of you have been doing this for decades, and some of you are really just starting out from the ground up. And so, we hope that you'll take advantage of the resources that are available on there to do what you guys need to do in your county. This is just a list of some of the archived webinars that are up there. As I said, this webinar is being recorded and will be placed up on the Stepping Up Toolkit website when it's done. So feel free to check out these, and we'll be adding more as we go along. 2017, we are actually launching a brand new series of technical assistance resources. And so we'll be having a new series of, like I said, webinars. We're doing a new thing called Technical Assistance Network calls that all counties are invited to participate in these network calls. We'll also be doing conference workshops, peer exchanges, small group networking opportunities like the quarterly small group calls that we'll be doing. And the monthly webinars and networking calls, we really see it as sort of the place to get the latest research and hear from your peers on what's happening across the country. Like I said, we're open to all people who are interested in participating, and we encourage you to join. We know that a lot of folks use these webinars as sort of training opportunities where they get their planning team together and everybody sits in a room and watches the webinars. And like I said, I mean, they can be reviewed, so you can watch them again later too. And the quarterly network calls are going to focus on smaller groups of rural, mid-sized, and urban counties who are involved in the initiative already as a forum for more discussion and more peer networking. So if your county has passed a resolution already, You will receive an email within the next week with an invitation to join one of these small group networks. And so, for example, rural counties will have an opportunity to have just rural counties on the phone to talk about some of the specific issues that face rural counties. In addition to the webinars and the network calls, which are all sort of site-based for you all, NACO is also hosting some related educational workshops at its legislative conference in February here in Washington, D.C., and again in our annual conference, which will be in July. And we'll also be spending this year updating a lot of the tools that are available on the Stepping Up Toolkit, including some companion guides and tools that would complement the 6 questions document that we're going to talk about today, a project coordinator handbook, an updated searchable website, and some more guidance on looking at data. So we hope you will continue to go back to the website and check out these resources and join us for all of these networking opportunities to be able to engage more with your peers on this. And just a quick plug, just to make sure that everyone is getting all of the emails and e-blasts about the latest news and the resources, and getting emails about things like the funding that Ruby was just talking about. Please be sure to sign up on the Stepping Up listserv. Just go to the Step Up Together website, click on the orange button, fill out your information, and make sure that you're getting all of the emails. So that's enough from me. I want to, let's get started with the webinar. Today we're going to provide an overview of the 6 questions and 4 key measures of success, and we're going to describe how the strategies provided in the report can assist counties in their efforts. And then we have a couple of folks from the counties who are going to share how they've been using the document in their own communities and moving forward with their own initiatives there. So you're going to hear from these folks, and I'm going to introduce them as they're coming up. So first is Risa Hanneberg. So Risa is a Senior Policy Advisor for the Council of State Government Justice Center's County Program. Risa provides technical assistance to county systems improvement projects, Stepping Up, and the Justice and Mental Health Collaboration Program. Before joining the CSG Justice Center, Risa served as the Criminal Justice Coordinator for Johnson County in Kansas. And in that role, Risa provided staff support for the Johnson County Criminal Justice Advisory Council, which is like a CJCC, and facilitated the coordination of criminal justice-related activities for the district court, the sheriff's, and the district attorney's offices, as well as the Department of Corrections, the Court Services Department, and Johnson County Mental Health. Her work in Johnson County included both juvenile and adult divisions, and major projects were the Justice Mental Health Intercept Project, Second Chance Act Reentry, JDAI, and Justice Reinvestment at the local level as well. She also previously served as the Chief Court Service Officer of the 10th Judicial District Court in Johnson County and started her career as a juvenile probation officer. So Risa, I'm going to hand this over to you.
Okay, thank you, Nastasia, and thanks to all of you who have joined on the webinar today. Speaking for the Justice Center, we're so excited to finally be releasing this document, Reducing the Number of People with Mental Illness in Jail, 6 Questions County Leaders Need to Ask. And for me, on a personal note, I'm just so excited that I was able to bring my experience in working in Johnson County to the Justice Center, and particularly in the development of this document, that I'm very hopeful you will find is going to be very useful to you as you guide your planning process for Stepping Up. Next slide. So what we've all heard for quite some time now from sheriffs and jail administrators is that jails really are where the volume is. With that daily churn of admissions and releases, you can see from this slide that the numbers at jails are extremely much higher than you see the churn of population within a prison. Next slide. And so when you start to look further into that jail population and look at the prevalence of mental illness, first of all, in the general population, it is seen that approximately 5% have serious mental illness. But when you're looking at jail, you see that it increases to 17%. And then when you add on co-occurring substance use disorders, you see that there's a population of approximately 72% that are in need of behavioral health services and supports. Next slide. So what are the factors that have been driving us into this actually state of crisis? First of all, we see that as disproportionate rates of arrest of those with mental illness at higher rates. And then this translates into those individuals coming into jails, and once we look at their average length of stay, we see that those with individuals with mental illness tend to stay longer than those without mental illness. And in fact, many of the studies and data that we've looked at the Justice Center indicates that it's generally in the range of 2 times longer. For those who are in jails, as well as looking at the time of discharge, we see that there's limited access to health care. And this then translates into the individual released to the community without the needed supports and services, and then continuing in that cycle of higher recidivism rates and returning to the jail. In addition to this factor is that those who are released and potentially are connected to services, that they may not necessarily be those services that are utilizing evidence-based practices. We know that when we look in particular at populations that not only are showing that they are mentally ill, but when that is combined with also higher criminogenic risk factors, that then you see this higher need and higher increase of recidivism and returning to jail. Next slide. So the document, the 6 questions document, as we referred to, was developed, and again, we thank our partners in this work. And I will now be going through actually the 6 questions and going through some detail. Although I will apologize in advance that I'm going to fly through these slides, and we will certainly be providing more information later. So next slide. Overall, the goal that we're all hoping to achieve is that there will be fewer people with mental illness in our jails tomorrow than we have today. Next slide. So the 6 questions that we feel that leaders need to be asking. So when your planning process is working and discussing and moving forward in this work and potentially reaching the point of recommendations, your leaders need to be asking, is your leadership committed? Do you have timely screening and assessment? Do you have baseline data? Have you conducted a comprehensive process analysis and service inventory? Have you prioritized policy, practice, and funding? And do you track progress? Next. So the first question, is your leadership committed? So kudos to all of you. I'm taking the guess that since most of you are on the webinar today, you've started in gathering this support from your leadership. You have hopefully received information or the mandate from your county elected officials that this work is expected. You've in the stages or have already formed a planning team representative of those from the behavioral health side as well as criminal justice and other community supports and providers that will lead to successful planning and increased success for those with mental illness in the justice system. Hopefully you don't skip the hard work of creating vision and mission statements and sitting down and developing the guiding principles that you wish to follow for your work. One that's near and dear to my heart is that you've designated a project coordinator. This is the role that I provided. And certainly I see that the crucial needs for having somebody who has a designated responsibility for organizing the planning process and making sure that the work is getting done and pushing the project forward. And finally, that you have a plan for showing the accountability for your results. Next. This is just a quick slide to show what a potential collaborative planning organizational chart might look at and something that you can review later. Next. The second question is, do you have timely screening and assessment? And certainly as I have been with the Justice Center the last couple of years, I see that this is one of the first implementations that a county needs to take on. The first step is, as you're sitting around your planning team, it's important that you have all agreed upon definitions for what is mental illness, what is substance use disorders, and what is recidivism. For we find that in many jurisdictions, the definitions of these will be different for those involved in criminal justice versus those who are maybe working in behavioral health. Certainly, I know from my experience in recidivism, there's always a debate around what will count as recidivism and not count. It's important to establish these up front. Then comes the process of establishing screening and assessment. You need to make sure that you're using a validated screening tool, and that if for those who are screened as positive, you have an assessment process in place. It's important that this process be efficient, meaning that with that quick churn of jails, with many individuals, released potentially within a few hours of booking, that you have created the process for this to be completed at the time of booking, and that it's done universally for all, so that you can start to get accurate results and indications of what your levels of prevalence are, and then follow through with that necessary assessment. And as you'll see on many of these slides, it's critically important that this data is collected electronically. Next slide. So I just wanted to show a couple of slides. This is from Salt Lake County, Utah, and just as an idea, they're doing a great job there in Salt Lake. Shouts out to them if they're listening today. They have instituted mental health screening. They have instituted screening for substance use, and on top of that, they are doing the LSI-SB, the screening version, to get a screening on criminogenic risk, as well as they have pretrial processes in place and have a separate pretrial risk instrument. For those who screen positive, assessments are then followed up with. The reason I like to show this slide is because I know this is a big investment up front in time and effort to get all of the screening done, but you can easily see how well it can be used throughout the case management process for the individual to inform decisions and make sure that best decisions are made for potential success of the individual. Next slide. And this is just kind of a review for you to look at later in terms of the steps that it takes to have screening and assessment in place. Next slide. Do you have baseline data? Again, another question that has to be asked, and as we go into counties and do this work, and perhaps you're already seeing it yourself, the first thing that you probably come into contact with is multiple data systems and accessing data and getting in data systems to talk to each other, establishing memorandums of information sharing agreements and information sharing structures in place tend to be some of the first hurdles that counties have to face. But to help you in this process, we have identified 4 key measures. And I know for one, I would have loved for somebody to have told me a few years ago, if you just track these 4 things, we can get you to the point that you can show your progress and track as you're reducing prevalence. So the first thing you have to do is you have to know what you have before you get started in being able to track progress. So you've got to establish that baseline prevalence rate of those with mental illness in your jail population. Secondly, you need to be able to track the length of time people with mental illness stay in jail. It is not unusual to see that jails are routinely tracking average length of stay, but when we ask them, are you also separating that between those with mental illness and those not, so that you can compare those populations, we see that that is work that generally still needs to be done. Then we move to connections to community-based treatment, services, and supports. For many jurisdictions, this is new work. This means that system of the justice, as well as those data systems of your behavioral health providers, need to be able to share and cross information, so that when the individual is discharged and leaves your jail, we can have some way of tracking the individual to ensure that the person has been connected to community-based treatment, as well as community-based supervision via probation, community corrections, and that the person is engaged. Otherwise, you're going to be looking at your recidivism rates with questions as to why haven't things changed. It's important that those community connections are in place, and then you can also be able to start checking and hoping that you've connected to the right levels of service to reduce recidivism. Again, that this is electronically collected data is crucial. Next slide. I'm just going to, one more time, review these 4 outcomes because it's important that if you are tracking those 4 key measures, you should be able to track these 4 outcomes. 1, that you're reducing the number of people with mental illness booked into jail, that you're shortening the length of time for people with mental illness in jails, you're increasing the percentage of people with mental illnesses in jail connected to the right services and supports, and you are lowering rates of recidivism. Next slide. Question 4 is, have you conducted a comprehensive process analysis and service inventory? And I'm guessing that many of you are nodding your head yes and say, yes, we're either in the process or have completed sequential intercept mapping. And certainly I do want to commend you for that work. But with the stepping up process, we are recommending that you also start with a system-wide process review. Now, why this is different is because we're asking you to, with your planning team, sit and walk through the step-by-step process from the time an individual has that initial contact with law enforcement to the final discharge from jurisdiction. And you identify all those key points in the process, and you ask yourself, what can we do better, faster? What can we do to have better results for the individual? That is then followed up with that inventory of services and identifying the what you have and the what you don't have. We ask that you also enhance this with identifying data points whenever possible. How many individuals are involved in each of those intercept points? How many individuals are involved in services that are provided? But how many do you have on waiting lists? What are those capacity needs? When you get through with that work, then you're in the position to identify those gaps and challenges and identify, what your next solutions potentially can be. It's important that those are based on evidence-based practices, and that you're looking at solutions that have some proven track records. Next slide. This is a slide to demonstrate what that process analysis looks like from a jurisdiction that has completed this process review from the time of law enforcement contact. And then you will see on the right side of the screen 5 flags that they've identified for their opportunities for improvement. Next slide. The 5th question is, have you prioritized policy, practice, and funding? And I always like to start here with saying you cannot skip questions 1 through 4 and jump to this slide. And as a person who's facilitated this process, it seems to be something that most planning collaboratives want to do. It's really easy to want to jump to what we should be doing and what we can do better. It's important that you spend that time on your data analysis, your process analysis, and identifying your capacity. And then you look at your options and spectrums of strategies. They're going to most importantly be ones that line up with those 4 key measures. If you're beginning to identify processes and improvements that aren't going to focus on the 4 key measures, you're not going to have any sorts of results that can then impact those measures. Along with that work, as you're getting prepared then to make the ask, whether it be for federal funding, whether it be for local, private, foundational funding, whether it be a grant, it's important that you've also done the work of identifying the costs and associated funding streams that could potentially be available to you. We know at the end of this process you're probably going to come to your county level to ask for those investments that need to be made, that there are no other gaps or no other resources to fill those gaps. Next slide. This slide demonstrates for you the options that you may be considering as you're identifying those strategies. I think it's important to look at this entire system as an opportunity for diversion. And when you have all the folks around your planning table, which is demonstrated there in the circle, you see the opportunities for connections to care and building the case for success. Next slide. The 6th question is, do you track progress? Speaking from experience, it's always on the to-do list, but maybe doesn't always get done. And so we want to really stress how important it is that you follow through with tracking your progress. Again, lining the measures up with those 4 key measures should give you the means to be able to demonstrate any progress and successes that you're having. Should also demonstrate to you when you're not making those kinds of improvements, and that maybe you need to come back to the planning table and reassess. I also just want to state that it's important to capture the small gains along with those large goals. And sometimes the low-hanging fruit and the small successes are just as important to point out as any other kinds of measures in terms of moving the needle on data. Make sure you have a process for reporting out your progress, that you are continuing to monitor any evaluations of programming that's been implemented that is maintaining fidelity, and that you have a process in place for ongoing impact of your programming. Next slide. Actually, Nastasia, turning this over to you now.
Great. Thank you so much, Risa. I appreciate that and appreciate your presentation. As Risa mentioned, it's a lot of information for a really short presentation, and over the next year, we are going to be doing bi-monthly webinars that dive really deeply into each of those 6 questions. And so, next month when we do the networking call, we'll dive a little bit deeper into question 1, where we're looking at, is your leadership committed? And then, subsequently we'll go through each of those ones in more detail. So this is not your only chance to learn about these. And again, these are in the 6 questions report that is available on the Stepping Up website as well. So I want to turn it over to Dwayne Holder. I want to go ahead and introduce him to talk about how Pitt County has been using the 6 questions in their Stepping Up efforts. Mr. Holder currently serves as the Deputy County Manager for Pitt County Government in Greenville, North Carolina, and he's also the Project Coordinator for Pitt County Stepping Up Initiative. Mr. Holder has more than 15 years of local government and behavioral health services administration experience. He began his local government and mental health career with the Pitt County Area Program for Mental Health, Developmental Disabilities, and Substance Abuse Services in 1998. As a result of mental health systems reform in the state of North Carolina, he became one of the founding members of Port Human Services, which is a regional private nonprofit behavioral health provider agency. He returned to county government in 2012 and currently serves on the governing board of Trillium Health Resources, which is a public managed care organization, and he is also a veteran of the United States Air Force and holds an undergraduate degree in business and a master's of public administration. So, Mr. Holder, I'm going to hand it over to you.
Okay, great. Thank you, Nastasia. Again, we want to thank everyone for being on the webinar and welcome. I want to just share some of Pitt County's experiences as we have been going through the Stepping Up initiative and kind of offer some county perspective as we've not only gone through the action steps for Stepping Up and also utilizing the 6 questions document, and as the representative from the Bureau of Justice Assistance mentioned earlier, and Pitt County was fortunate enough to actually obtain a mental health and criminal justice planning grant, and I want to talk a little bit about that as we go through the presentation as well. Just give a little background on Pitt County. Pitt County is a county that's located in eastern North Carolina. We're about midway between our state's capital of Raleigh and the coast, Atlantic Beach, North Carolina. We have a population of about 180,000 people, 10 municipalities. Our largest municipality and county seat is Greenville, which is about 90,000 people. Okay. Next slide. Pitt County is very fortunate that the topic of mental illness and actually substance abuse for that matter, obviously there's so much co-occurring disease that exists, but it's a topic that our community has been very aware of in the past. This awareness really permeates all of our local agencies and our partners, to include our county commissioners and our sheriff's office. Obviously, sheriff and commissioner buy-in are very critical for being able to effectively deal with the issue of reducing the number of mentally ill detainees in our county facility. Pitt County has a detention center that has a capacity of 500 detainees. Overcrowding has been an issue, and the sheriff and commissioners have even explored the feasibility in the past of opening additional pods at some pretty staggering annual operating costs. And so you'll see the last bullet that was got on the slide. Pitt County, we did a study, and our top 25 inmates entered the jail over 480 times. And these are inmates that we were able to identify as having a mental illness. Over 480 times since the year 2000, that totaled more than 20,000 days at a cost of $1.5 million. This was information that our sheriff's office was tracking prior to any mention of the Stepping Up initiative, or even knowledge of any grants that might be available with helping with the effort. And that's really what led us to where we are. Okay. Next slide. Just to give you a little timeline, in April of 2015, our sheriff's office applied for the BJA grant, and it wasn't until August of 2015 that our county commissioners adopted the Stepping Up resolution. We were awarded the grant in October 2015, and I just want to mention that because the fact that our sheriff's office was so up to speed, if you will, and so committed to addressing the issue and being aware of the issue of there being a problem with the number of mentally ill in our jail was very key in our getting started with the overall initiative for the county. Okay. In April of 2016, we had the opportunity, members of our Stepping Up policy attended the National Stepping Up Summit in Washington, D.C. And we believe that one of the reasons why we were selected to attend that was because of some of the work that had already been initiated with the BJA grant. And it was a very good experience. And just to give you an idea of the diversity of that policy team that went to that summit, and this is pretty representative of the representation that we have in all of our planning activities. The team consisted of a district court judge, a county commissioner, our chief deputy in our sheriff's department, myself, and a representative from our local mental health authority was slated to attend, but because of a family emergency was not able to. So we did have that pretty diverse team that was able to attend that summit. Some developments that we have seen as a result of our planning efforts, and this was as a result of the recommendation our planning team, our county commissioners actually appropriated funding to create what we're calling a full-time mental health, a jail mental health navigator position that's going to work to actually start I'm saying discharge plan, but release planning for those that are identified in the detention center at the time that they enter. We have one of the things we have in Pitt County is a very robust jail health service. It's contracted currently, but we do have psychiatric services available through our jail mental health services, and they work very collaboratively with the staff, and we're envisioning this navigator position also kind of functioning as a team, a member of that jail health team, and kind of bridge that gap between early identification as well as planning for release, advocacy while they're detained, and et cetera. Okay. Next slide. The mental health and criminal justice grant, I really encourage anyone that is on the line that has not had the opportunity to work with the folks at BJA, it's been a great tool for us in guiding us as a county through our planning efforts. One of the things that Risa mentioned was that there's a tendency to want to jump to solutions and skip over some of the what I really call the real hard work, which is establishing those baselines, assessing where you are, what you do, what's available. This grant is actually guiding us through a very formal process of doing some of that heavy lifting. And if you look, you'll see some of the goals. I've listed some of the goals of that planning grant, and I put here on the slide that they actually complement the goals of the overall initiative. In fact, if you look at the toolkit that was mentioned earlier, the Stepping Up Toolkit, you'll find that there are 6 action steps that are recommended for counties to go through in the initiative. They start with convening a diverse team, goes through to collecting and reviewing prevalence numbers and assessing individuals' needs, examine treatment and service capacity, develop a plan with measurable outcomes, and then step 5 is implementing that plan. Step 6 is creating a process to track the progress. The mental health and criminal justice grant that we are engaged in now is actually going to take us through the 4th action step. So out of those 6 steps, we see that the initiatives of the grant will take us through 4 of the 6 overall Stepping Up action steps. And so it's very helpful. The technical assistance, and I think if you can go forward to the next slide. Some of the, well, it's not here, but I will say some of the technical assistance that we're able to benefit from as a result of being one of the grantees has been invaluable. We've had site visits and the TA that we've received has just been top notch. And Risa is actually one of our technical assistance folks, and again, it's just been invaluable. But just going through some of the specific activities that we've initiated in Pitt County, we have identified a policy team. I've mentioned the terms kind of side by side. I've said planning team and policy team. Our grant, tied with our grant, we actually have a planning team that's like a work group that is going through the initiatives of the grant. We also have a Stepping Up policy team, and the planning team includes members of several local agencies and departments, both governmental, nonprofit, and and we have a lot of kind of mid-manager and staff level on that planning team. The policy team consists of the heads of many of those major local agencies. For example, on the planning team, we may have an assistant district attorney. On the policy team, we would actually have a district attorney. So just to give you an example of what we mean when we differentiate between policy team and planning team. But I mentioned earlier that some of the policy team attended the Stepping Up Summit. There's again coordination between the planning team and the policy team, and we are giving periodic updates to the board. At BOCC is our board of county commissioners, and the recommendations that come out of the planning team will then be forwarded up to the policy team for any policy changes or funding appropriations. Next slide. Again, I've mentioned some of the benefits from the grant. The only other thing I'll mention is use of P&I guide, and that P&I stands for Planning and Implementation. It's a very comprehensive planning guide that goes through different exercises to help to make some of that heavy lifting more bearable, and really breaks down some of the questions to make you really think as a community whether you do what you think you do, and helps you to better establish a baseline so that you can have data to which you can compare any progress that you're going to make later on as you move through any implementation of any of your strategies. Okay, next slide. Again, some of the outcomes of the grants. The outcomes of the grant are they directly complement really the outcomes of the overall Stepping Up initiative. Okay. Just want to give an example. Everything seems to start with this convening of an initial team, and in agreement with the grant, you'll see we actually did convene a team. I wanted to just list for you. You can see the diversity of the different agencies that are represented on our planning team. Okay. Some of the activities that the team has been involved with. Sequential intercept modeling was mentioned earlier. Just learning about what each agency does and what they're responsible for has been quite enlightening for our group. And then we talk about some of the assessment information and strengths, weaknesses, and I think can go forward. One more. Just wanted to share something that we did early on, a SWOT analysis for our county. We identified what strengths, weaknesses, opportunities, and threats existed as it related to the overall initiative of reducing the number of mentally ill in our jail. And you can see some of the strengths, weaknesses, and opportunities and threats that we identified as a county. Next slide. And that's the end of the presentation. It provides information if any counties in particular are interested in learning or hearing more about Pitt County's experience. I've listed my information as well as our coordinator of the grant, the Mental Health NCJ grant, which is a local mental health nonprofit in our area. So that's all I have, Nastasia.
Great. Thank you so much, Mr. Holder. I appreciate it. And what a great sort of plug for using the resources that we have available, and also you know, accessing that JMHCP grant that Ruby was talking about at the beginning of the webinar. I know you've been able to accomplish a lot with that. So thank you so much for that. And last but not least, I want to introduce the Honorable Roy Charles Brooks. Mr. Brooks is a county commissioner from Tarrant County in Texas. For more than 30 years, Commissioner Brooks has represented his community as a volunteer, a city official, and a county commissioner. Located in the north central part of Texas, sort of Fort Worth, Tarrant County serves approximately 1.8 million residents. Commissioner Brooks was elected to serve as a Tarrant County Commissioner in 2004 and has dedicated himself to addressing human services issues since taking office. He's worked diligently to provide constituents with opportunities to sign up for health care through the ACA, and has taken on issues such as health care for the homeless, infant mortality, obesity, health disparity, and AIDS education. He spearheaded many programs in Tarrant County, including the Tarrant County Ex-Offender Reentry Program and a Blue Ribbon Task Force on Healthcare for the Homeless. Commissioner Brooks also proudly serves as the National Association of Counties' first Vice President. Commissioner Brooks, the floor is yours.
Thank you, Nastasia, and welcome to everybody who has chosen to participate in this webinar. Let me just say initially that as first Vice President of NACO, inevitably I will become President of NACO in July of this coming year, in July of this year. And as President, I will get to focus my presidential year on an initiative of my choosing. We will focus in my presidential year on the human infrastructure of counties rather than the capital infrastructure of counties. We've spent an awful lot of time the last several years concentrating on our capital infrastructure, and that is, of course, vitally important because our people need to be able to get around. We need to be able to have the facilities necessary to conduct the people's business. So we've got to concentrate on roads, we've got to concentrate on facilities, we've got to concentrate on buildings, ports, airports, jails, all those pieces of capital infrastructure. But counties are more than just roads and works. Counties are people too. So I want to focus my presidential year on the needs of people living in counties. One of those needs being treatment of their mental health disorders. Now, like Pitt County, Tarrant County got into addressing the over-incarceration of mentally ill persons and persons with co-occurring disorders in our county jail about 2015, almost 2 years ago. We had been in the mental health business for decades, even had a mental health pod, still do, in our county jail. Our county jail has a population of about 4,500 people at any given time. So we knew that we had a problem with the incarceration, the over-incarceration of mentally ill persons, but we had no data on which to base that. It was all anecdotal. We got involved in the Stepping Up initiative and in addressing the needs of mentally ill persons in our jail through coming together to apply for a MacArthur Foundation grant that was to provide technical assistance for counties wishing to address that problem. In building the consensus to put that application together, it became very clear that, number one, it wasn't going to happen unless there was a champion highly placed in our county governmental structure to make it happen. And number two, it wasn't going to happen without a broad base of persons both within the county government and in the community at large. I stepped up to be that champion, and it just so happened that we had a committee called the, next slide, give me the first slide, please, Nastasia. The Criminal Justice Coordinating Committee. Now, the purpose of that committee is to be a forum with criminal justice agencies, general and community agencies to collectively discuss public safety and criminal justice issues and to implement best practices so that we can address criminal justice issues in a comprehensive way. Next slide. This committee, which we already had in place, proved to be the place where we could discuss this issue, build consensus, bring it back to our county board, and get approval to take it to the next level. Our committee includes 67 members. It includes every member of our Commissioner's Court. Commissioner's Court is a Texas term meaning county board. Our Commissioner's Court consists of 4 commissioners and a county judge. It's a 5-member body. It also included the sheriff, our IT director, our budget director, our county administrator, our judicial administrator, who is in charge of coordinating the activities of all of our courts, both our felony and misdemeanor courts, our family courts, our civil courts, and our justice of the peace courts. Our probation director, our county clerk who holds the misdemeanor court records, our pretrial release director who is in charge of our personal recognizance program, our medical examiner, our community development director who is the conduit through which HUD monies flow into our community, our county auditor, our district attorney, our district clerk, and our district clerk holds the felony court records as opposed to the county clerk who holds the misdemeanor court records, and our public health director. We used this body to examine what we did know and what we did not know about our jail population, and used that knowledge to put together a response to the MacArthur Foundation request for proposal. Well, we didn't get the grant, but we had built so much consensus in the process of putting together the grant application that number one, this over-incarceration of mentally ill persons in our county jail was a problem. Number two, we needed to address it. And number three, we knew we didn't have the data to back up any conclusions that we were to come to. So not having gotten the grant really galvanized us as a community. We decided that we had enough resources in our county to be able to do that with our own money without going into a grant relationship with MacArthur. So we engaged one of our local universities, Tarleton State University, to do a study of our jail, top to bottom. Who's in it? Why are they there? How long have they been there? how many of them have mental health disorders? How many of them have co-occurring disorders? And we added one more question. How many of them are there just because they're too poor to write a check to get out? We, within the last 6 months, have received the results of the Tarleton State study and are beginning to address the recommendations of that study. It's pretty amazing how the Tarleton State analysis and recommendations track pretty well those of the Stepping Up Initiative. And they did not have information on the Stepping Up Initiative to guide their study of our jail system. They recommended that we had to come up with a common definition for mental illness and for substance abuse disorder. They recommended that we work on our communication between the various agencies that touch on these problems with the common definitions in mind so that we could create a culture around which we could build solutions. They recommended that we had to have a continuum of care that went beyond that person's incarceration in our jail system. They recommended that we have some way of diverting mentally ill persons from our jail system in the first place. And they recommended that we educate the various stakeholders on how to use the best practices that we come up with during the course of carrying out the creation of a diversion plan in our community, so that we all spoke the same language, we all shared the same values, and that our constituents were the beneficiaries of our efforts, not just the mentally ill and co-occurring clients in our jail, but our taxpayers. We wanted to find the most cost-effective use of our resources to solve this problem. One thing that we recognized from the beginning was that the county jail is not a place to restore a person's mental health. You might be able to treat the symptoms, you may be able to keep the symptoms in line and keep a person medicated in jail, but medicating the symptoms is a short-term solution. And people are going to get out, so there's got to be some sort of continuum. We are working as a county to put in place a Stepping Up program, and I would love the opportunity to report again on where we are in terms of addressing these critical issues. Nastasia, that's what I've got.
Great. Thank you so much, Commissioner. I appreciate it. Great presentations, and great to hear about what Tarrant County is doing and how you guys got started and built some consensus. So we appreciate it. We just have a few minutes left for those of you who have questions. As a reminder, if you do have any questions, please type them into the questions box on the right of your screen, and I will ask them aloud. Since we only have a few minutes left, we might run out of time to answer some of those questions, and so we can have the speakers send you some responses via email. But really, I would encourage everyone listening on the phone to join us for the Stepping Up networking call, which is going to be on March 2nd at 2 o'clock Eastern Time. And you can register right on the Stepping Up website, stepuptogether.org/toolkit. And we'll be able to speak some more with some of the folks who are on the phone with us and answer some more of your questions. So I did have one question for Mr. Holder, and I was hoping maybe you can describe a little bit how the Pitt County model is going to be sustained beyond the grant period and how you are thinking about that in financial terms as far as going forward once that JMHCP runs out.
As far as sustaining that the planning, the committee, or the actual implementation?
The question was just sort of, you've been doing all this money with that, with using the money, the JMHCP money, to move with your planning process, and so I think they're curious about, how you're going to sort of keep up the momentum once that grant runs out, and how you guys are going to implement some of those pieces that you want to do if there's no federal grant funding involved, or if you have a plan for sustainability that way.
Oh, okay, I see. Well, I'll start off. The one strategy that we are in the process of implementing now is the navigator position that was mentioned. That position, for example, is going to be 100% county funded. As far as any other strategies that may be implemented, we haven't really identified any other strategies at the moment, but we'll definitely be not only looking to the county but also any of our partner agencies. There may be some function or strategy that is better funded by one of our partners than us. The other thing we're looking at is what is the county currently funding that we may be able to divert some of our existing funding from one activity that we may not find we're getting as much value for that we could from a new strategy that gets implemented. So it may not be all the time, it may not be new funding, it may just be reallocation of some existing funding. But the first position that's been identified is 100% county funded.
Okay, great. Thank you so much.
Mm-hmm.
Yeah, I think we have time for one more question, and a number of folks have been asking about how you get buy-in from your local stakeholders to participate in the initiative, whether it's a county prosecutor or your sheriff or your commissioners. What are some of the strategies that you all have used to get folks into this, even if maybe they're really not interested? And maybe we'll let Commissioner Brooks. Why don't maybe you could answer that sort of from a commissioner's perspective, and then Dwayne and Risa, you can jump in.
From a commissioner's perspective, as I said before, first you have to have a champion, and it helps if that champion is a member of your board of commissioners. That is because of the function of the Board of Commissioners. The board controls the budget for all of these county agencies, and when a commissioner speaks, it tends to get the attention of those whose budgets might be quickly under consideration for renewal. But more than that, the Board of Commissioners has a sort of bully pulpit in most communities, and when used properly, that bully pulpit can have a convening effect among not only county agencies, but community agencies to bring people together to focus their energies on the solving of a problem. So commissioners have a lot of ability to bring people together, and perhaps that's what we do best.
Great. Thank you, Commissioner. I don't know, Dwayne, Risa, did you have anything to add quickly? Nope. Okay. Oh, yeah, go ahead.
And go ahead. And I have a couple things.
Just real quick, I was going to say, in our case, you know, it was not only the county commissioner but the sheriff as well. Again, the problem was identified by our sheriff, and obviously that's another elected official, but our sheriff was a real cheerleader in our overall efforts to reduce the number of mentally ill in our jail.
Great. Risa, anything to add?
Yes, just a couple things too. Certainly, the champion. I think we have sheriffs who very much, you know, are asking for help in this issue. And then I think, you know, bringing forth that data is just very, very powerful. And so I'm not at all suggesting to use it, you know, to expose some situation in an uncomfortable way. I'm just saying that data really kind of takes the emotion and the subjectivity out of the situation, and clearly, you know, points everybody, I think, to rally around this issue and to, you know, very clearly see where next steps need to occur.
Great. All right. Thank you all very much for speaking on the webinar. This is really helpful. I just want to remind folks, as I did, the next Stepping Up activities, and we hope everybody will join us so that we can really sort of build up this network of folks. The network call is going to be on Thursday, March 2nd at 2 o'clock, and then the next webinar in the series will address question 2 of the 6 questions, conducting timely mental health screening and assessment in jails, and so that's going to be on I'm sorry, it's actually, I have the date wrong on there. It's actually going to be on April 6th, and I will fix that in the ones that we send out to you, so I apologize. It's actually on April 6th at 2 o'clock. So you can sign up for those at naco.org/webinars. And look out for those emails about the quarterly smaller group calls, so the calls for the rural counties and the mid-sized counties and the urban counties. You'll be receiving an email from those if you have passed a resolution to join the initiative. This is my information. If you have any questions, you can email me directly or email over to info@stepuptogether.org. And we appreciate everyone being on the call and hope you have a wonderful day.